Hello, I'm Lieutenant Colonel Wendy Lee, one of the coordinators for creation of the Military Sexual Assault Course.
And I'm Ann Burgess. I'm a professor at Boston College, but a visiting professor here at USIS. And we are delighted to bring you an online course on military sexual trauma.
This course is an interprofessional collaboration between the Graduate School of Nursing and the School of Medicine here at Uniformed Services University. We're bringing this course to you to, first of all, describe a little bit about sexual assault and its impact in the military.
The other important factor or instructive is any subject that is studied always has a history. And so we will be presenting very briefly some of the history that is seen through the art and the literature through the centuries to give you a better perspective that this topic is has a long history and is quite old, even though we're in the 21st century.
So we'd like to go ahead and summarize all the units that you will be experiencing as you progress through this course. First of all, in Unit 1, we're going to talk to you about the history of rape since several hundred years ago through the military, and also we will give you some examples of cases that have been studied in the military that depicts sexual assaults that have occurred.
In Unit 2, it's important to realize that to have a victim, you have to have an offender. So we will start off with the sexual aggressor, or the rapist, and talk about the research that's been done on classifying this type of offender. And this will set the stage for better understanding the victim. There will be assignments for you to go online and to read about some of the cases, the military cases that have occurred.
And then in Unit 3, we're going to bring it to more of the hands-on portion that as a provider will help you proceed to understand what you can do for the victims. We're going to first of all talk about how to improve your interviewing of sexual assaults for not only the victims, male and female, but also the offenders.
Part of the process, if you will, of what they call making the case is collecting the evidence, so that Unit 4 will include evidence collection, the type of evidence, how it is collected, and there will be great detail on that, not only in your readings in the textbook, but also in looking at some of the videos that have been accumulated for your learning. There is the Craigslist killer out of Boston, where the Boston Crime Lab is going to show you how they collected evidence in that.
And then Unit 5 is we're going to bring in some JAG lawyers to explain to you the importance that the evidence you collect from the patients during your physical exam and how that plays into either convicting or finding if someone is innocent. And so we're going to talk about some of the pitfalls and also some of the good things that occur from providers helping with the legal actions of cases, and that is all presented to you by OSI agents and JAG lawyers with a lot of experience in dealing with these sexual assaults in the military.
In Unit 6, we're going to talk about treatment, and this is what kind of treatment do you give to the victim. We will have material on acute care right after the assault, what we call the post-assault, and then there will also be information on the longer-term treatment, that is the models of care, if you will. And there will be videos on about 20 military persons that have survived a sexual assault and have recovered.
And then also in Unit 7, the last unit, we will talk about a lot of the extra research that has been done in pursuit of improving military sexual assault processing and evidence collection. We'll also talk about some of the advances and policies that have now come around with improving programs in military sexual assaults. Then lastly, we're going to show you a video on what you can do and how you can instruct your patients on ways they can decrease their vulnerabilities to sexual assaults in their everyday lives.
Some of the assignments that we have, we've talked a little bit about it. There will be text readings. There will also be little quizzes, reflection papers. But I think most importantly also, because this is an interprofessional course, that there will be opportunities for the nursing students and the medical students to work together, such as...
Yeah, so we're going to have about an hour and a half to 2 hours of nursing students and School of Medicine gathering at the Simulation Center, not only interviewing a patient, going through the sexual assault kit, and then coming together in an interprofessional collaboration discussion about, you know, what your experiences are at the Simulation Center, and also what your life experiences have been with these kinds of situations. There's also going to be a scenario at Bushmasters where you'll gather and come together to treat sexual assault victims. Let's see.
And there's one last one. It's the panel. There will be a panel of actual prosecutors, the detective, the providers that worked on 7 cases that were all linked by DNA to one military person, and that will be a panel by those persons as well as questions from the audience, which will be the nursing and the medical students.
And so I hope you enjoy the course that we put together, and we appreciate your feedback as it goes on. Thank you.